So, for our next part of the lecture, we're going to talk about what really led to the creation of the Patient Protection and Affordable Care Act. I thought that this graphic or this cartoon was pretty interesting to say why it was so critical for those who were not insured to have access to health care. And basically, it shows you this young family. I'm gonna click this off. This young family that had from week to week was kind of walking on a wire, not knowing if financially they'll be able to make it, because if anything ever happens, if their kids get sick or if they get sick, then that could be their financial demise. So it could be a really scary time, and that also means lack of access to healthcare resources and lack of access to pharmaceuticals and to assistance with getting eyeglasses, which are pretty darn expensive, and other healthcare needs from week to week because you don't have health insurance. So, who exactly are the underinsured or the uninsured? Well, before the Patient Protection and Affordable Care Act, this population made up about 16% of the US population, meaning there were about 49 million people uninsured. Most people were insured by their employers or through government-funded programs. 5% had private non-group coverage, but again, they're about 16% of our population that did not have uh, access to insurance. By the way, that total number was at the time the number of people being counted in this pie graph. So the uninsured, who were they? They're often the younger, the invincible, the it won't happen to me, I'm not going to have healthcare providers pay for, or I'm not going to pay out of pocket for my health insurance, I don't really need it right now. They were also the near poor, the people who don't qualify for Medicaid. They earn too much money to be able to have Medicaid, but they didn't earn enough to be able to afford healthcare insurance. So they fell in that gap. Men without children. So there are different programs that help assist women and women with children to get healthcare resources, but men who didn't have children had a hard time getting insurance. And individuals who were self-employed or employed at small businesses. These small businesses have a really hard time being able to subsidize some of the healthcare needs for their companies. And so often small businesses worry about going out of business if they offer health insurance, subsidized health insurance. So they will have their employees pay out of pocket for their health insurance. So what are some of the consequences of not having healthcare access? Well, you're not getting your preventive care you need. Forget about going and meeting up with your primary care provider unless you're going to a free clinic. You're less likely to screen for diseases, so when you see a healthcare provider, you present at more advanced stages of disease, and you're less likely to receive treatment once you've had a diagnosis. So yeah, now you've been told, oh, you have XYZ condition, but you can't actually do anything to treat it. You're less likely to have a usual source of care. More people would rely on going to the emergency room, which if any of you have ever had emergency room care, you know it's really incredibly expensive. And there's an increased mortality, over 20,000 cases of excess deaths per year, linked back to not having health insurance and healthcare access. Oh, okay. So we already know one part of what led to the formation of the Affordable Care Act, right? 16% of our population, 16% didn't have healthcare insurance. But what else led to the formation, and what led to there needing to be a change in our country? Well, as far as healthcare systems are concerned, we spend by far the most on healthcare. But does that necessarily mean that we have equitable care? For the most part, we do usually have high quality care. But for as much as we're spending, why weren't 16% of our population being covered and able to access healthcare? Also, if you can start looking at the growing expenditures, you'll find that federal funding has been spending more and more and more, and yet healthcare is still getting more and more unaffordable. And again, not everyone's getting healthcare coverage. Also, if you were to compare the United States to other more developed countries with decent healthcare systems, you'd find that our patients were the ones, or our populations were the ones that were most likely not to get a prescription filled or skip doses of medication because they couldn't afford it, to have a medical problem, but less likely to go visit a doctor because of health access issues, skipping a test or treatment or follow-up care. And also, one of an individual who said they've had more than one, or at least one or more of these issues in the country. So obviously we had a broken healthcare system. Patients needed healthcare reform because they weren't able to get healthcare. The U.S. economy needed healthcare reform. And also healthcare services and clinics needed healthcare reform because it just became so expensive, especially in comparison to the equitability or how equitable our healthcare system was at treating our nation's constituents. So next up, what I want you to do, I've posted a link for a Powtoon that described the basic tenets of the Patient Protection and Affordable Care Act.